Hey guys, so lecture two for chapter 21. We're going to talk about special considerations in the head spine injuries. Um, Seen pictures like this before. This is an impaled object in the cheek. Bleeding is our concern here. Not a lot of arterial vessels. In other words, we can remove this impaled object. It's not going to be something that's going to be extremely concerning as far as bleeds are concerned. What it really is concerning about is affecting the airway. That's what our big concern is, affecting the airway. Allow blood to drain and stabilize impaled object. This would be a penetrating wound. Reality is, guys, what we're looking at here, we're looking at a burn mark from a gunshot wound, but they're showing this as an impaled object. And again, any impaled object needs to be stabilized in place. We're going to use gauze pads and Kerlex roll around to keep that impaled object secured in one place. Maintain a patient's open airway and show empathy. Whenever we have any facial injuries like this, airways are a priority, and they always are. But in this case, we really are concerned about their overall airway because of the bleeding and swelling that can happen in these areas. So we want to pay close attention to that. Soft tissue injuries to the face, mouth, tongue, and cheek, ear, nose, jaw, and teeth. Again, if you're looking closely at this, you can see this is a gunshot wound. Okay. We have the entry wound here, which is small. We have the exit wound here, which is large. I apologize if this is rough to see, but this is what we're talking about here. These are soft tissue injuries to the face. This is causing trauma to the neck. It's trauma to the head altogether. This is a pretty bad situation. Neck injuries, possibility of severe bleeding, pulmonary embolus, and blunt trauma. We want to make sure that we control these bleeds the best we can, and this is going to be simply direct pressure to control this the best we can, trying to keep any air from getting into it. Eye injuries. I don't know about you guys, this kind of stuff bugs me though. It's hard, eyes are just one of those tough things. Tenderness or deformity to the orbit, soft tissue injury around the eye. So this we have some tissue missing from around the eye. Foreign objects in the eye, injuries to the globe. We have bruising, cuts, and lacerations to the globe. Pupil reactivity, double vision, something people might complain about. Inability to move eye normally, which if that's the case, we want to move it at all. Dress or cover both eyes. Gently pressure for bleeding. Gentle pressure for bleeding. Do not remove clots. Do not force eye open, and do not flush unless chemicals are present. And so, any of these eye injuries, these are the things we want to do. And this right here, guys, is one of the best ways that we can manage an impaled object of the eye. That object can be protected underneath this styrofoam cup. I wish we were in class because this is something we actually do in class together just to practice the procedure. Flush with water for foreign objects. Remove objects with sterilized gauze. Use lower lashes to remove objects, and cover the eyes. And when we talk about covering the eyes, we actually talk about covering both eyes. Some people will tell you, or some books will tell you, one eye needs to be covered, the other needs to be open. But the problem is with both eyes, with one eye open, we're still able to move the other eye with it. It tracks. So when the injury is severe, we've got some sort of object in it that really hurts when you're moving your eyes. Cover both so the eyes don't move anymore. Impaled objects into the eye, major threat to vision, of course. Never remove this object. For if you're not aware of this, the eye itself is actually filled with vitreous humor. Vitreous humor is a fluid that actually looks like water, and it gives us our structure. By removing that object, you're not going to bleed out, but what you are going to do is lose that fluid. And once it's gone, that eye is no longer any good. This person needs to go to surgery to save their eye. And we need to stabilize, and that was that cup being used. Global injuries, cover with sterile dressings, cover both eyes. Extruded eyeball, the eyeball actually pops out. Do not attempt to replace the eyeball. There's no way you could do it. It needs to be surgically reimplanted. Cover with moist dressing and cover both eyes. Again, don't want the eyes moving. Remember this: if you have one eye covered but the other eye open, any kind of movement to your side, it's a natural reaction for you to look to see what it is. You move your eyes to track, correct? And the problem with this is Your eyes are connected. You can't move one eye, you move both eyes at the same time. So by covering one eye and leaving the other exposed, we're increasing the possibility of them moving their eyes. Cover both eyes so neither of them move. Orbit injuries, deformities, difficulty moving eye, double or impaired vision, and numbness around the eye are things that we might see as far as assessments. Chemical burns, take immediate action, flush for 30 to 60 minutes. Personal protection is important for you. You don't want to get any of this on you or in your eyes. Remove contact lenses if they have them. One of the more common things we see here, guys, pepper spray. That's what you're going to end up seeing most often is that pepper spray in the eyes that's going to cause that kind of blurred vision. Open the eyelids, press down and forward on the edges of the lenses. Slide lens out of the out of the eye, out of the mouth, excuse me, out of the eye, and remove and place in lens in safekeeping. We should have something that we can place those lenses in because they are expensive and you don't want to lose those for the patient. And that's it for that one. I believe we have one more lecture after this. So I'm going to go ahead and post this, and please be prepared for some questions that will be coming your way soon. Okay, thank you very much, guys.